Hi, everyone. My name is Tim Bober. I'm the Chief Medical Resident for Quality Improvement and Patient Safety at VA Pittsburgh. Our university affiliate is the University of Pittsburgh Medical Center, Presbyterian Shadyside. Of course, this is all in good old Pittsburgh, Pennsylvania. Today, I would like to talk about my CRQS project, which focused on implementing text paging to improve nurse and resident communication on night float at VA Pittsburgh. So night float coverage at VA Pittsburgh relies on a numeric paging system for communication between nurses and the single night float resident. This resident is responsible for admitting and cross coverage of requests, which can make it difficult to triage requests when one receives multiple pages at one time, aka being hammer paged. I collaborated with nursing leadership on two med-surg floors to pilot the use of text paging through the Amion application for bedside nurses to be able to communicate with the night float resident. Uptake was limited somewhat due to staffing shortages and limitations with COVID, but our nursing colleagues were able to provide excellent feedback about the application and help to quantify the differences in time to compose and receive text responses for tasks. I am performing in-person, in-service educational sessions about how to send text pages, also creating time studies with our nursing colleagues of numeric versus alphanumeric pages, and timing the time to response as well. To help remind nurses to use the text paging option, I created laminated cards, including details for sending alphanumeric pages that will be placed on the workstation on wheels as a visual reminder for using text paging. Ultimately, my hope is that this will become the standard means of communication for night float at VA Pittsburgh for both day and night shift. To start this project, I worked with a nurse manager and assistant nurse manager to implement this text paging system. Among nurses, there is a cultural preference for numeric paging because this is a more efficient system for their workflow. If they are able to dial star 1 2 on the VA system, they're able to page a VA pager. While if they're able to dial 412-647 page, they're able to send a numeric page to a UPMC pager. Furthermore, which makes things more complicated, nurses at VA Pittsburgh do not have access to the text paging application known as MedTrack, which is used at UPMC Presbyterian and Shadyside. Teaming with nursing leadership, again, I performed in-person in-service sessions at night to educate the night float nurses about ways to use text paging in a safe and confidential way for patients and providers. Before this session, I worked with the VA Privacy Office to be sure that all components were HIPAA compliant and respectful of patient privacy. Fortunately, either through Amion or MedTrack, there was no easy way to track numeric or alphanumeric pages and response times. Thus, we had to engage our nursing colleagues to time themselves, including the time to compose a page as well as the time to receive it. We also asked the night float residents to track the approximate number of times that they received text pages versus numeric pages as well. As I mentioned, there's been a lot of turnover and some staffing challenges with COVID, but we've been able to track a total of 34 pages, 20 text pages and 14 numeric pages. The average composition time for a numeric page was 15 seconds, with an average response time of 3.48 minutes, while the average composition time for text pages was 106 seconds, considerably longer, and 11.8 minutes. While it took longer for nurses to compose and receive responses, these colleagues did notice that they often got more detailed responses from the night float resident. At times, they would even batch multiple requests into one page and found that their response times had improved. Interestingly, the night float resident noted that having their personal number listed on Amion led to an increase in personal phone calls as well, sometimes for non-urgent issues. There were some inconsistencies following the paging template, which led to delays in processing time for the resident. Overall, the implementation of this text paging pilot did not yield a significant change in the distribution of numeric versus alphanumeric pages, but did help to assist night float residents with triaging tasks for cross coverage. As I've alluded to, barriers to implementation included nursing turnover on floors, the competing demands with the COVID pandemic, and the inability to track text pages without manual time studies. I will also note that it was important for me to pivot halfway through this project to a second med-surg floor, which was a key insight in my learning process. I would also add that I was able to have better engagement on the time studies whenever I worked with a nursing champion on the med-surg floor to help them engage their own colleagues. Again, a very important insight. This has been such an honor and privilege to serve in this role and to perform this project. I will carry forth these lessons as I transition to my role as a clinical research fellow at UPMC Presbyterian Shadyside and UPMC Health Plan next year. Thank you.